Hello everyone, greetings everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Welcome everyone to our special Instagram live session. In this live, we will be shedding light on a condition that affects millions worldwide. Acne isn't merely a surface issue, it can deeply impact one's emotional well-being. Beyond the physical blemishes, it can erode self-confidence, leading to anxiety, depression, and social withdrawal. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why in today's life, we are aiming to dispel myths, promote understanding, and empower individuals to seek effective treatment. Today, we are diving into the topic acne management with our skin expert. Whether you're struggling with breakouts yourself or simply curious about maintaining clear, healthy skin, this session promises to be both informative and engaging. Today, we are honored to introduce Dr. Astuti Apurwa, a renowned skin expert from New Delhi. Dr. Astuti Apurwa is a highly qualified dermatologist with an MBBS and MD in dermatology, leprosy, and venereology from Dr. D.Y. Patil Medical College, Navi, Mumbai. She is an academic orator and had talks in multiple conferences. And today we are here with her. On today's live. A warm welcome to you, Doctor. We are privileged to have you with us today, and we will be sharing her insights on acne and its management. We extend our heartfelt gratitude to you for joining us. Without further ado, let's dive into the first question, which is what is acne and what are the types of acne lesion?
Thank you so much, Priyanjali, for having me. So now let's start. I'm going to use very simple terms so that everybody is going to understand it. So acne primarily is an infection of a pilosebaceous unit. Pilo means your hair, sebaceous means your oil-producing gland, and unit means a complete unit. So not only does it affect your oil-producing gland, but it also affects the hair which is coming out of it. Okay, so it is the inflammation of your primarily oil producing glands. So now it is also in multiple in scientific terms it is called as acne vulgaris, as you mentioned, and the word acne is derived from the term called as peak. It is a Greek word, and anything which is pointy on your skin was termed as acne primarily. Okay, so now acne is your inflammation of the pilosebaceous unit. Now, different types of acne is categorized depending upon physiological features, like how we see through naked eyes, or depending upon the age group. So, acne is seen in infants, so it is called as infantile acne. It is seen in
Mm,
pre-adolescent age, so it is called as pre-adolescent acne, which when it is less than 7 years of age. Then comes your adolescent age when it is seen in teenagers, and then in adult acne. So there are primarily four types. And then for us, physiologically speaking, there are different types like comedones, papules, pustules, but those are scientific terms.
right. So, Doctor, which are the usual areas where we see acne occurring?
So acne can happen anywhere, primarily on the body, but on the face it is most common, and then on your
Mm,
trunk, on your upper arms. It is very
mm,
common. On your neck, it is very common. So people who are gym goers, people who you will see carrying a lot of backpacks, people who are taking certain types of medicines, you will see them primarily having acne on their backs. So not
mm,
only face, there are other body parts area also where acne can happen.
right. So, does different area has different causes behind it?
Yeah, absolutely. So when it is happening around your hairline, we mostly hold your hair products responsible, your seborrheic
Mm,
dermatitis responsible, your fungal
mm,
infection responsible. Then when it is happening around your nose, if you have a oily T zone, then it is leading to that. When it is primarily happening on your cheeks and your pillowcases is held responsible, your phone cases is held responsible, because this is a bacterial infection, right? We keep our phone like this, we use the same phone case on our other cheek without sanitizing it, we are
mm,
using the same dirty pillowcase for months on end without changing it. Then our lower jaw is primarily the place for hormonal acne. So different uh, parts of the face is primarily related with different types of acne. So
right,
most likely, the cosmetic-based acne is seen on your cheeks. In girls, when they
right.
are using oil-based products, you will primarily see them getting acne on their cheeks.
Right. So we are saying that hygiene plays a very important role here.
Very important
Uh,
role, because at the end of the day it is a type of an infection, right?
right.
So when you are using the same phone case without sanitizing, you are using a towel, you are not washing your makeup brushes regularly, you are not changing
Hmm.
and sterilizing them properly. So now when you are using makeup brushes and not sterilizing them, because it's a bacterial infection,
Hmm.
soap and water is not going to
Right.
be enough for it, right?
Right.
So if you're doing that, then obviously it is going to aggravate it. It is cannot be the causative factor, but it is an aggravating factor for sure.
Right. Now, a lot of infections are contagious. Speaking
Hmm.
of acne, is acne contagious, doctor?
It's not contagious. So, see, it happens due to a bacteria called as Cutibacterium acnes, which is present in your skin and my skin as it is. Okay,
Hmm.
so it is called as a commensal flora. Commensal flora is present on everybody's skin. The problem with this in acne is because of the altered sebum production, or the quality of the oil increases and the quality also changes. Hence, the bacterial overgrowth happens. So, that is the problem over here. So the point is that it is not contagious, but it can flare up. Taking not taking care of the hygiene will lead to extra growth of your commensal flora, which will lead to higher chances of you developing pustules and thereby leading to scarrings.
Right. Because you're mentioning about that, doctor. What are the different grades of acne, if our viewers would want to know?
So there is a Pillsbury classification. So there are four classifications. So grade one, 2, 3, and 4. So in grade one, you see primarily comedones. Comedones are
Hmm.
your blackheads and whiteheads, and you see less
Hmm.
number of small little bumps. In grade two, you will primarily see those small little, very light pink color bumps on your skin, which are called as papules. In grade 3, you will primarily see more number of pustules. When your patient comes and tells you, I get a lot of pain when even my phone touches my face, when I try to lie down, that is your grade 3. Grade 4 is when you have all these pustules, they come together to form big nodules and cysts. And then they are like, big blobs on your face. Now that is grade 4.
Right. Now, doctor, speaking of the grades of acne, tell us the initial stage which you are mentioning, the comedones. We normally treat it at home, or we visit the nearby parlor to treat it. So, can that be safe for us, for the people who are widely using all those nose strips, or the parlor wali didis removing the blackheads
So
or
you
whiteheads?
have to understand that your comedones are your baby pimples. Okay,
Mm,
once a comedone has formed, they will turn into a grade 3 pustule sooner than later. आपको premenstrual
mm,
flare होगा, and sooner than later you are going to develop it. That one little bump onto your face is going to turn into a pimple. So you don't have to take it lightly. The idea is to hit the iron rod when it is hot. So once you started
right,
seeing that you're getting a comedonal flare up, you start to treat it then and there, because once they have formed, they're not going anywhere. Second
right.
thing, going to a parlor, whether it is a good idea or not, it is, I personally do not suggest so. Why?
Mm-hmm.
Because the mechanism with which they extract without needling, they try
Right.
to extract it directly. That
Mm,
pushes your sebaceous filament or the keratinous material more so inside than it comes outside. And the more
mm,
the material goes inside, the more inflammation it is going to cause. On the
right.
surface, it's going to look as if, oh, the keratin plug has been removed, it is looking cleaner. But at the end of the day, after that facial, after 2 to 3 days, you will end up with a lot of eruptions on your face. So that is not
Mm.
the idea. You should get it manually removed, but through a dermatologist. And you should consider getting chemical peels along with it, because there are certain peels like black peel and salicylic peel which serves beautifully in comedonal stage. It works beautifully on it.
Right. So we are saying that the initial stage is treatable, because most of us have no idea. We are like, इसको तो maintain करके चलना है हमेशा. We cannot treat it completely. But is it completely treatable?
Acne is absolutely completely treatable. Absolutely
Mm,
completely treatable. There is
right.
no to say in it. It is not like there are so many medications now available which permanently reduce the size of your sebaceous glands. and you should meet a dermatologist again to take those
Mm,
medications,
mm,
because that is done under supervision, and with couple of blood tests need to be done every 3 to 4 months to monitor that. And
right.
it is absolutely treatable. Now, having said that, a lot of people associate acne with PCOS nowadays, and they say because PCOS is not treatable, so is
Mm,
acne not treatable. It's nothing like that. Acne is a part of PCOS. Acne is
mm,
a manifestation of
mm,
PCOS, but acne is pretty much treatable. You have to treat your underlying hormonal issues to treat acne. That is, there is no two ways to it, but it is pretty much very,
mm.
very, very treatable.
Right. Now, doctor, speaking of the treatment which you're talking about, what are the current treatments which are available to treat acne?
So it depends at what age group you come to me. So if you're a teenager
Mm,
and if you're reluctant in taking oral medications, I usually suggest them to start getting a regular chemical peeling done, and then along with it a proper home care regime, which will include your
mm,
salicylic acid, will include retinoids, will include certain type of antibiotics, will include BPOs, azelaic acid. There are 10,000 topical medications available just
mm,
to maintain a
mm,
teenage skin. Okay, then comes your dietary restriction. Most of the time in teenagers, just with certain dietary restrictions, you can deal with your acne very, very well. Then comes your if you're getting adult acne, you have to identify the underlying cause as to why it is happening. Some people, as I said, is happens because of pomade acne, which is called as acne caused due to cosmetics. So is your
mm,
acne is happening to you due to the skincare that you're using? Is it happening due to the hormonal issues like you have, like PCOS? Is it happening to you because of the diet that you are taking? Are you taking something which is triggering it? Is it happening to you because of certain medications? Like I told you, OCPs can cause acne. Your anti-epileptics can cause acne. There are certain antipsychotic drugs like lithium and certain sertraline and all, which can cause acne. So you need to identify the underlying cause first before you go on to the treatment. There are oral and there are topical medications available, and they are very easy, 5 to 10 minutes of your day. It barely takes 5 to 10 minutes of your day to maintain a good, healthy skin.
right. Uh, Moving ahead towards the next question, doctor, what about people with sensitive skin? It becomes a huge deal for them uh, to maintain the skin or choose the perfect skincare for them. So, does acne look a little different for them as well?
Oh, yes. In sensitive skin, so you have to be really particular when it comes to sensitive skin. But anything you put onto their face, they will flare up. They'll get a lot of
Mm,
purging. They'll get a lot of redness, right? So the primary motive over here is what? To repair the barrier of the skin. So for that, you give them a proper moisturizer. So now, see, there is a myth with sensitive skin people and oily skin people that you don't require a moisturizer, but it is
mm,
absolutely wrong, because see, there is a difference between oil and water, right?
mm,
Your
mm,
moisturizer is giving hydration, that is pani, right?
right.
And tail is different, sebum is absolutely different, right? So you
Mm,
cannot
mm,
put both of them together and expect each of them to work, for each other. So the idea
right.
over here is that you layer your products over on top of your moisturizer first, the whole serum first and then moisturizer later. No, with sensitive skin, that is
Mm,
not how it works. The primary base requires to be a ceramide lipid rich moisturizer along with anti-inflammatory agents in it, which will help in calming down the redness of the skin and help in repairing the barrier. And then you start with topicals or medicines with lower percentage. Say for
mm,
example, for someone like a skin like yours, I can begin with 10% azelaic acid or 20% azelaic acid. But for someone with a sensitive skin, I might not do that. I might start with only 5%, and I might
mm.
ask sandwich it. Sandwich method is like when I ask you to apply your moisturizer, then your medicine, and then again your moisturizer, keeping
Okay.
your, yeah, so
Lock it.
keeping the irritation to the most minimum that we can.
Mm,
And then along with it, you have to give an anti-inflammatory. Okay, and along with most likely the people who have sensitive skin just don't have acne. There is a entity
mm,
called as rosacea. Okay, so there is a component called as acne rosacea. So most likely these people are not only suffering from acne, but they're also suffering from acne rosacea. So you have to treat the rosacea component as well.
Right, right. So, now speaking about skincare, doctor, as you have already mentioned, there are s- hundreds and thousands of options available in the market nowadays. Previously,
Mhm.
we had to visit the dermatologist for such products or such
Mhm.
references,
Mhm.
but nowadays everybody is using such products on themselves. I personally know people who have um, 12 steps of skincare. They have 8 steps of skincare.
You
So,
don't need it. You
yes,
absolutely don't need it. Your face wash, a good moisturizer, sunscreen, or and one active a day is more than enough. Is more than
mm,
enough. That is personally
mm,
how much I use. I do not do more than that. I don't have the time or the patience to be doing more than that.
right, right.
So you don't need it. You don't absolutely need it.
Right. Especially when we're talking about skincare, skincare has to be something which we are doing on a daily basis. So it
Exactly.
is a repetitive task. You have to maintain the consistency. You cannot just apply it one single day and you think that the other day you will start glowing. It does not happen like that. It takes time. It takes a
Absolutely.
lot of time to show
Absolutely.
changes on your skin. So
Absolutely.
maintaining those 12 steps, 8 steps every single day. Also, we don't know if it's right for our skin. So getting the product just from the market, looking at a video or watching somebody having a nice good skin after using such products is not something we should do. But talking about chemical peels, which you were mentioning initially, does it remove any sort of stubborn marks?
Oh, yes,
Can
it
it
does.
remove?
So there are different types of chemical peel. There is superficial chemical peel, medium, and deep chemical peels. So medium and
Mm,
deep chemical peels are known to
mm,
reduce superficial pigmentation. They are known to reduce and soften up superficial wrinkling as well. So
mm,
they work beautifully when it comes to
mm,
post-inflammatory hyperpigmentation or the
mm,
blemishes, as you call it. They work
right.
absolutely beautifully. It's just that what we understand. See, the idea is that once you have left your dermatologist, you are given a sheet, okay, with a
Mm,
post-home
mm,
care sheet, right?
mm,
You have to
mm,
go
mm,
back home and apply those things. You just cannot
of
just get
course.
a chemical peel done and just be ki, okay, now my skin is going to glow. No. So when you do a
Mm,
chemical peel, you are actually chemically removing the upper layer of your skin. So you're compromising
right.
the barrier. So there are certain
Mm,
things which are suggested to you for maintenance of the barrier. But if you are not willing to maintain the barrier after a chemical peel, the chemical peel is going to be counterproductive.
of
Okay.
course.
And
Yes.
what you said, I would like to tell this to the audience. Like, see, a lot of times when you go and you ask कि 15 दिन में हो जाएगा क्या, 20 days में हो जाएगा क्या, okay, it doesn't happen like that. So your skin has
Mm,
5 layers in it. The innermost is called as stratum basale. Okay, so stratum
mm,
basale takes 90 days to come above. Okay,
mm,
so we give a minimum of 90 days to any medication because your
mm,
stratum basale or the innermost skin layer takes 90 din, right? So three
mm,
months
mm,
time for any medicine before we say ki, no, this is not working for you, because the
right.
innermost skin takes that much time to come up and to show. Okay, so in 15 days, you still have your stratum corneum intact. Then nothing has happened. It is not shedding, right? It is going
Right.
to take 90 days to shed. So give it that much
Mhm.
time. See, just because you're rushing and because you have a wedding to come, science doesn't listen to that. Science is going to take its time, right? So it is
Right.
going to take 90 days, no matter how much in a rush you are. So please be very
Mm.
patient with it. Minimum we say 6 to 8 weeks, but scientifically speaking, this is our MCQ
Right.
question for doctors. How many days does it take stratum basale to become the stratum corneum? It takes 90 days. Keep it in your
Mm.
mind that that is the least number of time you require for your skin
Mm.
to show the effect of any medicine that you are applying.
Also, when you're doing it consistently on a daily basis, only and
Yes.
only then you cannot
Yes.
just skip it for
Yes.
a couple of days and then start from the
And
very
just,
fourth
yeah,
day.
because giving up after 5 days, 10 days, and wondering why it's not working for you. No, it takes time. You
Yes.
have to be extremely patient with it.
Right. But doctor, are there any adverse effect of chemical peels on our skin if
Oh yes. So chemical peels are pretty harsh, right? They are higher strength, like 30%, 40%, 50%. So it needs to be done with a very regulated hand. It needs to be
Hmm.
timed. You need to check the quality of the skin you're doing it on. So you cannot do
Right.
it on an excessively dried out skin. You cannot do it on a rosacea skin. You need the inflammation to be reduced before you do a chemical peel. For that, you need to have a vigilant eye. It's
Right.
like saying, does do guns have any side effects? Of course they have side effects. I mean, like, they cause
Hmm.
wars, right? So guns can
Mm-hmm. Of
cause
course.
wars, but they are used to also protect your country, right? So
Right.
you need to
Right. Right.
understand that it can cause burns if it is given in the wrong hands. It can cause, in
Mm-hmm.
fact, adverse side effects if it is given in the wrong hands. So you need to identify who you are getting it done from. And there is, again, a lot of people come to me asking, ki, ma'am, I have read somewhere that chemical peels cause thinning of the skin. No, they do not cause thinning of the skin. They
Mm.
accelerate. जो 90 डेज मैंने अभी आपको मेंशन करा था, they accelerate the 90 days. The epidermal
Mm.
turnover time gets reduced. So the rejuvenation becomes faster, in fact, but the thickness of the skin remains the same. Or, in fact, in
Mm.
certain cases with certain peels, the thickness of the skin gets better. So that's an absolute myth that it will thin out your skin, it will cause burns. It can cause burns, but if it is done under, someone like a naysayer on Instagram, probably. So
Right.
yeah.
Right. The only reason for asking this question was,
Hmm.
of course, it's very important to choose your
Hmm.
expert or your professionals very wisely.
Yes,
There are a
absolutely.
lot of people who are not a certified dermatologist, but then they're offering the same treatments which we
Hmm.
are getting
Hmm.
in our dermatologist's clinic.
Hmm.
So there are a lot of people who are claiming to provide the Korean glass skin, which
Hmm.
there is a huge hype in the market for fair skin, for
Hmm.
glass skin. So these people are offering such things. But again, you need to choose your experts, your professionals very
So
wisely,
Korean glass skin, if you
because
ask me, I'd say you have a Korean glass skin. Okay, because you are literally shining at all the right places, and it's absolutely beautiful. So the idea is that you need to identify ki bhai, my skin is healthy. I don't have marks on my face.
Mm,
I don't have any bumps on my face. I have an even skin tone. That's about it. Do not go
right,
after marketing gimmicks. Okay.
right.
You have certain you cannot change genetics. I cannot begin to look
Exactly
like a
my point.
Korean, right?
Exactly my point.
Yeah,
Exactly. I mean, genes play a very important role when we are talking about our health, our skin, our hair,
absolutely,
everything. It depends on our genes. So you cannot just turn Asian one fine day and you cannot just
absolutely,
come back to the same
absolutely,
way.
absolutely.
This is not possible. But
Not
yes,
possible.
um, we have seen wonders happening with skincare. Uh,
Hmm.
our skin can drastically change if we are using the right product under the right guidance. So make sure
Absolutely.
if you are visiting an expert, make sure the expert is a certified expert who can give you the uh, right
look
decision or
look
the right
out for
suggestion.
look out for a DVL degree, look out for MD degree, look out for FRCS, look out for
Mm,
FCPS. These are
mm,
your certified dermatologists. Okay, you
mm,
need to
mm,
see an MD in front of the degree's name, or a DVL in
right,
front of that's a diploma.
right.
So you need to say that. One more thing I would like to emphasize: there is nothing called as a cosmetologist. There is nothing called as an
Mm,
there is nothing called as a trichologist. Okay, a
mm,
dermatologist is the one who is doing and dealing with cosmetology, trichology, and this is a new term I have seen a lot of people use, acnologist. There is no such term written in Oxford dictionary. People have just come
mm,
up with it. So please, don't fall for that. Go and ask for the degree. See the degree. According to your the MCI, you're supposed to have the degrees published in the clinic of all the
mm,
doctors. So if a
mm.
doctor is not willing to show you the degree, you should know that they are not, they're scared for
The right
certain
person.
reasons.
Yes,
Yeah,
yes,
not the
yes.
right person. So you're supposed to, show it up in at your reception or in your chamber, and you can even
Hmm.
ask the person, "Ki bhai, what is your degree? Like, please let me know
Right,
because you. This is health.
right.
It's at the end of the day, like before buying a lipstick, we see 10 swatches, right? I mean,
Exactly.
on YouTube. So please,
Uh,
do your research before you go to someone.
Obviously, I mean, doing your homework is so much important. People nowadays are already very much aware of the situations. They know things. Also, social media has been a boon in such case, but we need to use it in the right way. So,
Yeah, yeah.
make sure you do your homework whenever you are opting for any sort of expert, that you are visiting the right person, because ultimately we are talking about our health here. You cannot put
Absolutely.
your skin at risk. You cannot put your health at risk. Coming back to diet, doctor, because we are talking about skin here, diet plays a very important role. We know that हम जैसा खाते हैं वैसा ही हम दिखते हैं. So what sort of diet does acne patients need to take in, or any do's and don'ts for them?
Yeah. So first thing is your skin is your largest organ, right? So whatever you're putting in is going to show up onto your skin. So the first
Hmm.
thing you need to stop if you have acne prone skin is dairy and dairy products. First thing. Okay.
Hmm.
Second is any high glycemic indexed food. So when I say high glycemic indexed food, I mean anything which gives you a very point blank insulin spike. Okay,
Hmm.
so anything which is very rich in carbohydrate. So people ask me कि pizza allowed है क्या if I have a wheat based pizza. So wheat based pizzas come with not just the wheat base, it comes with a lot of cheese on top of it as well, right? So if
Right.
it is causing a lot of insulin spike for you, that food item will eventually lead to you getting acne. Okay, say again I had a patient come to me ask कि भाई momos तो high protein होता है ना they because it is chicken and it is steamed, so it is not high protein because it is made up of maida surrounding it, right?
Hmm.
So and it is even though it is steamed it has oil inside. So
Hmm.
anything which will lead to insulin spike, this is basic funda. ठीक है कि
Hmm.
कोई भी चीज जो आपकी इंसुलिन एंड शुगर लेवल्स को बढ़ाएगा will lead to eventually increase in the size of your oil producing gland or sebaceous gland, thereby increasing your acne. Second, dairy products have been known to and been very very well studied to cause increase in your acne. Okay. Third thing which actually helps acne patient is probiotic. So the one food item which we actually allow patients, dairy product which we allow patients to have is curd and chaach. So
Hmm.
curd and chaach ke alawa, rest all dairy is an absolute no. Your junk khana is an absolute no. Anything which you're
Hmm.
cooking at home, your green vegetables, your chicken, meat, mutton, everything is fine. I just want it to be made in less oil. That's about it.
Right. Anyway, if these are the things which we follow in our life, I think we can be relieved from a lot of health issues. So having
See,
a healthy diet is anyway.
sugar as it is, see, dermatologists swear by two things, sunscreens and no sugar. So, this is our
Yes.
life mottos. Okay, so no matter what, please try and avoid try and avoid sugar as much as
Mm,
possible. And
mm.
please, if you have acne prone skin, you are not the right person to be having too much of milk.
Right, right. Sugar, anyway, the last day I was just watching a video where the person was saying, जिनको regular chai या coffee पीने का आदत है. I mean, they love their morning tea and coffee. और चाय में चीनी बिना, what kind of tea is that? There are a lot of people who believe so. So, the video says that अगर आप चाय पी रहे हो जिसमें दूध आप खौला के पी रहे हो, आप उसमें चीनी डाल रहे हो 2 चम्मच, उसके बाद आप चाय या कॉफी पी रहे हो, then you are not tea addicted, you are sugar addicted. तो ये
Absolutely.
शुगर का addiction is the worst sort of
And
addiction.
one more thing I would like to clarify is that sugar cannot be replaced with good. So a lot of
Hmm.
patients come to me and tell me कि मैम हम चीनी नहीं खाते हैं, हम तो गुड़ खाते हैं. Okay, so
मिश्री
गुड़
खाते हैं, also
मिश्री
मिश्री
खाते
is
हैं, मिश्री
hmm,
गुड़ every all these things again basic science funda. will lead to the same amount of insulin spike as your one chammach
Mm,
of sugar will. Okay, so there is
mm.
no difference in it, except for the
Right.
except for the part that your good and mishri is unrefined, so they might have
Mm,
certain more number of minerals and vitamins attached with it. Apart from that,
mm.
there is nothing to it. They are plain empty calories, and they are going to cause the same amount of insulin spike, and they're going to be as hazardous for your acne as your plain white sugar is.
Right. Also, doctor, actually, there are a lot of substitutes, sugar substitutes available in the market nowadays. What about people who need to have sugar on a
So
daily
your
basis?
monk fruit is fine. Your stevia is absolutely fine. You can
Mm,
use it once in a day, but don't
mm,
overdo things. Once or
mm.
twice in a day, you can absolutely have it. No issues whatsoever.
You're right. And what about sugar from natural sources, fruits, suppose dates,
Okay,
and
you absolutely can. Absolutely can. Absolutely can. Natural sugars are nothing to be stopped. You can absolutely have it.
right,
So now
right.
again, now
Also,
coming to
doctor,
that one thing, because you mentioned fruits, a lot of
yes,
people
yes.
get aggravation of acne after having mangoes, right?
Mm,
So
mm,
that is a known phenomena. So certain people do get aggravation of acne after having mangoes. So that you need
mm,
to identify. That cannot be told by, via a doctor. Like say for example, I cannot look at your skin and tell कि अरे आप आम खाओगे तो आपको pimples बढ़ जाएंगे. That
mm.
needs to be identified on a personal basis, and that can
Right.
happen to certain people, because again mango is a very high glycemic indexed fruit, because it has a lot
Mm,
of calories, a lot of sugar. It comes under high
mm,
glycemic indexed fruit. So when you are
mm.
having that, it can lead to aggravation of acne in certain people, in a very limited number of people, but yes, it does.
Right. Um, Doctor, speaking of that, we are talking about diet here. What about hydration? Does hydration also plays a very important role when we're talking about acne?
No, it doesn't. Your oral hydration doesn't help with acne at all. No matter which
Mm,
film star tells you to drink 3 liters of water in a day, it's not going to help your acne. Okay. So, see, hydration is required for the maintenance of your body. Okay. But hydration for skin is to be applied externally. Okay, so that is why we keep telling that no matter how oily your skin is, please find the right oil free moisturizer for your skin. Okay, so
mm,
just because you have a acne prone skin does not mean that you do not require hydration for your skin. Okay, you do not
mm.
require a moisturizer, you do require it, but drinking water 4 liters, 5 liters, 6 liters is not going to be sufficient for it.
Right. People nowadays have we also get to see water diets जिसमें वो लोग सिर्फ पानी पे डिपेंड करते हैं, any sort of fluid, but yeah, fluid पे पूरा दिन उनका डाइट
So,
चल रहा है.
so I'll tell you, a lot of people will come and tell you after that कि जब हम कीटो डाइट करते हैं, जब हम
हाँ.
वाटर डाइट करते हैं, my skin begins to glow. Why? Because आप उसमें हाई ग्लाइसेमिक इंडेक्स फूड को नहीं खा रहे हो, राइट?
Hmm.
सो दैट इज गोइंग टू हैपन. आप पिज्जा नहीं खाते हो कीटो डाइट में, आप
Right.
पिज्जा नहीं खाते हो वाटर डाइट में, सो ऑब्वियसली इट इज गोइंग
Hmm.
टू हेल्प. Okay, the
Hmm.
concept, it's very basic. It's like maths. 1 plus 1 is equals to 2, right? So that is
Hmm.
a universal truth. That is not going to change no matter which diet you are doing. If you are not
Right.
eating high glycemic indexed khana, your skin is going to glow, irrespective of whether it is paleo, it is keto, it is water, or whatever lun fun diet you come up with.
Right. Now, we are also speaking about sunscreen. We know the importance of sunscreen in today's world. But initially, I still know a lot of people who does not apply sunscreen because they were not brought up like that. They never used sunscreen during their childhood. Nowadays, dermatologists, all the dermatologists ask us to apply our sunscreens in no matter irrespective of wherever we are. If you're stepping outside, if you're inside indoors, we need to apply our sunscreen. So, is this a marketing gimmick or does it actually work?
Okay, so you need to understand first that you don't live in the same world as your mother did. Okay,
Mm,
the food is not the same, the air is not the same. If you live in Delhi, the air is surely not the same. Okay, the lifestyle is not the same. Okay,
mm,
so sunscreen is a must nowadays for us, because see, you cannot control your genetics, but you can control your epigenetics. Epigenetics
mm,
is anything which is your environment. So environment can be controlled. Your genetics cannot be controlled. Your external stimulus can be controlled. So that is why
Mm,
people, say for example, my mother started aging at the age of 29 or 30, or 35 was the age when
mm,
she started having her first wrinkles. Probably even I would start it at the same time. That cannot be changed because that is genetically encoded. But I can slow it down
mm,
because my mother did not use a sunscreen, but I can. I
right.
have been well educated too. Okay, a lot of people again will, there is a whole thing about no sugar, as we've just discussed. Our parents
Mm,
used to, give sugar, a biscuit, and दूध में मिला के बिस्किट खिलाते थे बच्चों को, right? Cerelacs देते थे. Nowadays people don't even do that. Why? Because it has led to an sudden increase in diabetics, hypertensives,
mm,
metabolic diseases in our country has shot up like anything, right?
mm,
So we are second to America now in development of metabolic diseases. So that is
right.
the reason why sunscreen has been so popularized by dermatologists. That is the reason why we've been teaching everyone. You see, you cannot control your genetics, but you can control the outside, the environment. Okay, you can, if there is one thing which is anti-aging, anti-pigmentation, okay, and will give you a healthy skin, will protect you from the pollution, that is your sunscreen. It's your best friend.
Right. Right. And you can literally see the change on your skin. I mean,
Yeah,
you
yeah,
just applied
absolutely.
for a 1 or 2 months maybe, and for sure you will see the change on your skin. Your skin will naturally start glowing. Anyway, you need to protect your skin wherever you are. For the people, for the ladies who are watching us right now, housewives, who are always
Women
indoors.
who I would also like to emphasize, women who are working in the kitchen constantly,
Hmm,
they
hmm,
don't apply sunscreen, saying कि हम तो घर पे रहते हैं मैम, we don't
hmm,
require it.
hmm,
Okay,
hmm,
but the infrared radiation that you're getting from the chula is still hitting your skin. You see pahadis, people on the beach, they tend to age faster than the rest of the population. Why?
right.
Because the sun rays hit them directly. So imagine
Hmm,
sitting in front of the chula all the time for 4 hours in a day, 2 in the morning, 2 at night, preparing your food. I mean, eventually it is going to show up on your skin. And see, you cannot, I
hmm,
just cannot ask an Indian housewife कि आप कल से खाना मत बनाओ. But I can tell you कि here is your sunscreen. You can apply this and go and do your job.
right. Right.
So that is
So,
really must. And one more thing, on your UVA, UVB rays penetrate through clouds, they penetrate through windows. So no matter how gloomy it is, how cloudy it is, how polluted your city is, these rays are still reaching you and they are still
hmm,
causing the damage. So please, please apply your sunscreen irrespective of the weather and irrespective of the geography and irrespective of whether you're inside or outside your house.
right. Doctor, well, we now know the importance of sunscreen, but tell us, how should we choose the right sunscreen for us? It becomes a huge task, especially for acne patients. What kind of sunscreen should they normally opt for?
So generally, when a patient comes to me, I ask them, what kind of look do you like? So men generally are very lost, but women have a
Mm,
choice. Says women will
yes.
tell me that I like a dewy look, I like a matte look. So depending
Mm,
upon that, first is your the quality of look that you want. Second is the skin
mm,
type that you have. Third is
mm,
that the product should be non-comedogenic. Okay.
mm,
Fourth is it should have higher strengths of SPF. Fifth is it should have your UVA, UVB invisible light spectrum covered. Okay, and I also ask my patients whether certain patients come to me who are work from home and they are sitting in front of the laptop a lot. So you need to understand their lifestyle also. So the sunscreen also needs to have blue light coverage in it. So
right.
blue light coverage initially comes with your addition of physical sunscreen into it. So and again, whether your patient is lactating, pregnant, what age group the patient is, there are a lot of ifs and buts. So for acne prone skin, what you can start with is to read the dabba and see if it says non-comedogenic, if it says mattifying, because that means that it is oil free. That means that it is not going to block your pores. And basically
Mm,
nowadays I think almost all our sunscreen is for Indian skin tone. Just FYI, SPF 30 and above is absolutely fine. You don't need to buy SPF 60, 100. Okay, because
Mm.
geographically we are lucky. We are placed in such a situation that we do not need such higher percentage. And SPF 30 and SPF 50 has just 1% difference of sun protection. So your SPF 30 has 97% sun protection and your SPF 50 has 98% sun protection. So there is a
Okay.
mere 1% difference. Okay, so that's not very huge. Okay, so even
Mm.
if you get a good quality sunscreen which is giving you the kind of look that you want, okay,
Mm.
you can go with it. So it depends, right? So a lot of patients will come, they will usually ask me ki I want it to be very liquidy. Some patients like it moussey, some like it gel like. So
Mm.
then you have to ask for the preferences and then you decide.
But we are so lucky now that we get every possible thing available for our skin.
Absolutely,
Uh, yes,
absolutely.
even we have
And I would
pigmented
like to even,
sunscreen. Yes,
yes, yes, tinted sunscreen is there where you don't need
tinted sunscreen.
to apply a BB cream or a CC cream or your foundation. Okay, just
Mm.
probably a concealer here and there, and you're set to go. I mean,
Right.
it's beautiful. Yeah, absolutely.
Yes. Right. So, doctor, what about makeup? Should acne patients normally avoid makeup? If so, what about people who needs to apply makeup on a regular basis? What are the resolutions or preventions for them?
Okay, so first and foremost, acne can aggravate makeup.
Mm.
Makeup can aggravate acne
Yes.
because it can
Yes.
clog your pores. So
Mm.
you have to first identify whether your makeup brand is oil free or not. Okay, and
Mm.
there are certain brands which are oil free. And by the way, Indian brands are kicking it out of the park right now with your
Mm.
makeup. So I personally tell my patients to read whether they are oil free or not, whether they are non comedogenic or not. Second thing is, please learn to wash your makeup brushes, or better yet, use your fingers. No matter how fancy it looks to use a blender or a makeup brush, I would still suggest my patients who have acne prone skin to wash your hands before you start blending. And third is that I ask them to apply a certain medication or a certain keratolytic primarily, before their primer, to prevent the exaggeration of or aggravation of acne. So that can also be done. So
Right.
sterilization of your makeup brushes, choosing the right kind of makeup product, and third is application of certain medications prior to your application of the makeup.
And removing the makeup
Oh
once you're
yes.
back
Oh
home.
my God. Double cleansing. When you come back home before you go to bed, please double cleanse. Certain people tell me ki I don't like a cleansing balm. Use a micellar water. Use a
Mm.
micellar water. It's easy to carry. You can just wipe off your entire makeup with it, and please wash your face with an salicylic acid based or an AHA or any other BHA acid based face wash post that. Okay, and
Mm.
please follow it up with a retinoid at night, because retinoid sunscreen are your best friends for acne prone patients.
Right. Well, very informative session, Doctor. We got to learn so much from you today, and I believe everybody is already enjoying the session. We have few questions from the viewers, which
Please,
we'll
please,
take, I
please
guess.
do.
The first question comes from Palkesh, who asks, "Does vitamin D help with acne?"
Uh, there have not been much studies actually for it, but vitamin D is considered to be not just a vitamin, it is also considered to be a hormone. Okay, so
Mm.
vitamin D helps with your PCOS for sure. So if you have hormonal imbalance, which is leading to your acne, then vitamin D is an absolute must.
The next question, Doctor, comes from Abhishek, who asks, "Is there a connection between acne and oily skin?" We were talking
Yeah,
about it
of course, of
throughout
course,
the
of
session.
course. So the idea is that your sebaceous gland produces more oil, and not only is the oil quantity more, the quality of the oil is also altered in patients with acne. So yes, anybody who has oily skin, see, also have oily skin, but if I maintain
Mm-hmm.
my skin, if I'm using the right products, the acne doesn't show up. But the altered oil production and the quantity obviously matters.
Right. The next question comes from Meenal, who asks, "How does weather affect acne?"
So yes, very very good question. So usually your summers you will tend to find a lot of flare ups for acne. Why? Because you tend to sweat a lot. Sweat is khana for your cutarium bacterium acnes, right? So the population of the bacteria tends to proliferate more, and because of the sweating, you tend to, the hygiene issue comes into play, and you tend to spread it also more onto your face. So that is why you see acne flare up more in summers than in winters. Also in winters, because your skin tend to dry out, right? So your skin is as it is on a drier side of the scale. So and on in winters also, because you're using a lot of moisturizers. So people, just by using a lot of moisturizer and using the right kind of moisturizer, you can also calm down your acne, right? So that also is really beneficial.
Right. The next question, doctor, comes from Firoz, who asks how important is sleep in acne management?
Okay, so you have to understand the concept of circadian rhythm. Okay, so circadian rhythm is what time. A lot of people who have night jobs will come to you and tell you कि मैं 3 बजे रात में सोता हूँ मैम, मैं मगर 6 घंटे सोता हूँ, मैं 9 साढ़े 9 बजे उठता हूँ. तो a person who's sleeping at 3 बजे रात में and getting up at 9 a.m. 9 a.m. in the morning, and a person who's sleeping at 10 and getting up at 6, are their hormonal cycle going to remain the same? No. The
Mm,
person who's sleeping at 10 and getting up at 5 or 6 will have a better circadian rhythm. The hormones which are supposed to be secreted at the particular time, the time period is, by the way, between 5 to 7 a.m. Okay, so 5 से 7 बजे when you're sleeping, your body takes it as a matter of stress कि अरे bro,
mm,
this body is under stress, let's not
mm,
secrete any happy hormones, let's secrete all our conservative hormones, let's secrete all our storage hormones, let's secrete our cortisol. Okay, because that is all of your protective hormones, and that will eventually lead to what? That will lead to increase in the size of your sebaceous gland, again
mm,
increasing your acne. And also altered circadian rhythm is also related with increased amount of stress in your life. No matter how difficult it is for us to believe our mothers ki jaldi so and jaldi utho, okay, it actually works. It is scientifically
right.
proven. People are doing studies on it also now. Okay, where your acne and your in fact your PCOS is directly related with your circadian rhythm. Your even
Mm,
for men, your body repair mechanism, your muscle repair is related with your circadian rhythm. So that is how important it is. Okay,
right.
just because you're sleeping for 6 hours, but the time period between which you sleep is also very very important.
Right. And doctor, the last question today comes from Pooja, who asks, can acne lead to permanent scarring?
Oh, yes, it can. It can lead to severe, severe scarring. Okay. So again, a lot of teenagers who come and say कि मैम ये तो teenage का बीमारी है ना, जैसे अपन बड़े होंगे it will go away. But that's not how acne
Mm,
works. Okay, so acne, if it has led to permanent scarring on your face, can only be reduced. It cannot be removed. No matter
mm,
how much money you have, okay, no
mm,
matter which
mm,
doctor you go to in India, abroad, wherever, no matter how much money you have gotten to throw, there is no laser which is known to reduce, or no procedure which is known to reduce acne 100%. Okay, so
mm,
it can reduce it by 50 to 60%, but that's about it. Okay, it can get refilled, you can do fat grafting, you can do fillers, you can do so many other things, but they are temporary, they are not permanent solutions. Okay, if
right.
you are someone who are getting fillers for your acne scars, you need to repeat it every year. If you're someone who's gotten fat grafting done for your acne scars, you need to repeat it every probably 2 to 3 years, but you need to
Mm,
repeat it.
right. Well, we had a wonderful session with you, doctor, today. Before we take a leave, any take-home message for our viewers who has watched us so far?
Uh, Keep it very simple. What I tell my patients, the products that you're using should not be very expensive. So meet your
Mm,
dermatologist, pay the dermatologist to find out the right products for you so that you can continue to use it for a longer period of time. Okay. Second
mm,
thing is acne is very, very treatable. As I said, once the scars have formed, there is no looking back. You can reduce it, you can never remove it. So, please do not wait for the permanent damage to happen for you. Third thing is that you are Instagram is a boon and a bane for us. Listen to
Mm,
everything, understand everything, but please be very selective with what you use, and keep it very
mm.
simple and very minimalist. Use a face wash, a good moisturizer, sunscreen, and probably one active in the morning and one active at night, and you're sorted.
Right. Right. Well, that was expert advice for today, and that was Dr. Astuti Apurva for us. Thank you so much, Doctor, for your valuable time. It was a
Thank you
very
so
informative
much.
session, as already mentioned, and it was great to hear from you. We look forward to many more such sessions in coming time. Also,
Thank you
thank you,
so much.
viewers, for your excellent participation. For more information and updates, stay connected on our beautiful Spotless Skin page. We are also available on YouTube, Facebook, and Twitter. Thank you. Stay safe and stay healthy.
Bye.